Good morning, everyone, and welcome to our annual Radon workshop. We have a very full schedule for today's, but before I introduce our moderator, I would like to acknowledge that we are emanating from the city of Vancouver, situated on the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Okay, we will go through our business right away. So to introduce with no further ado, I would like to introduce our moderator for today's workshop. She doesn't need any further introduction, as most people here knows her very well. Pam Workington is the founding member of CARST and a CNRPP certified measurement professional. She is also the executive director of both CARST and CNRPP and the project manager of the Take Action on Radon program. Pam works closely with the CARD's board of directors and the CNRPP Policy Advisory Board, and she also coordinates with Health Canada and radon stakeholders across this country. Okay, Pam, take it over.
Great. Thanks so much, Men. And thank you all for joining us. This is an important opportunity for you to hear more about radon. And we've got some great speakers who are going to come and share information to expand what you maybe already know and share some of the current things that are happening in radon across the province and even from across the country. So thank you again for joining us. We will start off with a little bit of basic information. You may have come today with a little bit of knowledge of radon, or maybe you have a lot, but we know that you are going to learn something new today. But we want to make sure that everybody has a little bit of the basic knowledge, and that'll help you as you listen to the speakers today. So I'm going to start with that. So radon is the leading cause of lung cancer for non-smokers. And radon exposure also increases the risk of a smoker chance of getting lung cancer. In fact, Health Canada estimates that over 3,000 Canadians per year are dying of radon-related lung cancer. Radon is a risk because as a gas, we breathe it in and it decays in our lungs and causes the link to lung cancer. Now, radon originally comes from uranium. Uranium is a solid. It stays in the ground, but as it decays, as you see through the decay chain there, when it comes to radon, radon is the only gas phase of the uranium decay chain. And so as a gas, it can move up into the air around us, and it is in low levels in the outside air, but our concern is that any building that has contact with the ground can build up to elevated levels. So much of our research from across Canada comes from BC, Saskatchewan, and Ontario from historical research. And in fact, the research that we've done in Canada contributes to the body of research that happens around the world. So radon is a concern as exposure increases, and that exposure is combined with the amount of radon that you're exposed to and the duration of time. And so you can see in the graph here that it is a linear line. So as the amount and the time increase, the risk increases. And it is greater risk for those that have the smoking history, ever smoking or current smoking history, but it is certainly a risk for anybody, regardless of their smoking history or not. And in fact, Lung Cancer Canada has recent stats to talk about the percentages. So 24% of cancer deaths are coming from lung cancer. It is the leading cause of death in Canada. And unfortunately, 70% of those that are diagnosed at a stage 3 and 4, which means that their chances of survival are low. In Canada, in 2024, 32,000 people were diagnosed with lung cancer, and over 20,000 of those died from lung cancer in 2024. And so it is important as we talk about radon and lung cancer, prevention is the message, and that is because of the diagnosis often occurs late. And so when it's diagnosed at the stage 3 and 4 level, it is often hard to treat. Okay, so I mentioned that it's a gas. It comes from the soil, so it's in our soil all across our country, and it comes into our home and buildings with contact with the soil. So it can come in any opening, and it comes from that change of pressure. And so it is invisible. We can't see it. There is no way to know what the radon level is except for to test. But we do know it exists. And so it's important to find out how much is in a building or in a home. Now, there's different ways that you can test, but the key information is when you do test, you want to make sure that you test in occupied space. So think about a room in your home that you spend 4 hours a day or more, like a bedroom, a home office, or a family room. So we think about the basement first and test in the basement, but if you don't use your basement, then test in your main floor. And when you set up the test, you want to make sure that you test for 3 months or more, so 91 days or more. There are different types of devices out there. So there's one-use devices that you can see on the screen. There's electronic devices that you can use. And so there's different ways that you can test. But the key is pick a room, pick a spot in the room, and then leave it for that long-term test. Now, once you do the test, you will need to figure out what your radon levels are. And Health Canada recommends that if your levels are above 200, that you take action to mitigate it. So you reduce your levels. And so you can check out information on Health Canada's website, and you certainly will get some more information as well today. And if you do need to reduce it, then we have a national certification program in Canada. So CNRPP is our national certification. You can find a professional in your area. And in fact, our first speaker is going to join us shortly to talk a little bit more about mitigation. But before we introduce Graham, we're going to listen to Jill's story. Jill was diagnosed with lung cancer, and she now uses her voice to share her story with others to ensure that that they can learn the lesson of prevention as well. So let's hear from Jill.
They finally had a specialist consult me, thrombosis specialist, and she immediately ordered a chest x-ray, which showed pretty evasive lung cancer throughout both lungs, lymph nodes. So after that, I was given a CT scan, and then immediately was sent over to, or referred to Abbotsford Oncology, and started the process of chemotherapy and radiation therapy. That's been ongoing now for 4.5 years. I've had 4 doses of different types of chemo, and the effects of that have been pretty harsh. Right now I'm on a immune therapy medication, which gives less symptoms, side effects, and I'm able to function at a fairly normal level, but still much of a couch potato. And I also reached out to CREA because I feel that the radon issue is a national problem and it needs national address on an urgent basis, because the airtight homes, the energy efficient airtight homes with the government drive is really causing a lot of radon buildup in our homes, our daycares, our schools, and our workplaces. So I'm hoping with this little interview that people can see that radon is not something to fool around with. It causes serious consequences and it needs to be addressed on an urgent basis. When I was a realtor, we were told about radon, and that was 20 years ago. So I had heard of radon then, but the sad story with that is that when they were teaching the course, they said, you have to look at the geographical map. And the Fraser Valley and the Lower Mainland are not affected by radon. So I knew of radon, I've heard of radon, but I thought, oh, well, that's fine. We're not affected here. So that is another reason that I really want to address this. If you think that your home is safe from radon, you have not tested your home. The Fraser Valley is not a high risk area for radon. Every home in the world possibly can have radon. Your neighbor could have radon, you don't have radon. You have to test your home.
All right. Next, we're going to have Graham Cooper share with us. Graham is the current Vice President of the Canadian Association of Radon Scientists and Technologists. He owns and operates a radon gas mitigation company in the Okanagan. Graham has been involved in over 400 radon mitigation system installations over the past 6 years throughout BC. He's happy to be involved with speaking engagements to share his experience and knowledge with various audiences. Graham is also a paid on-call firefighter with the Summerlin Fire Department, where he's been serving in his community for the past 20 years. Graham, I'll get you to share your slides and join us.
Okay, thank you, Pam. And actually, I'll bring up my slides in just a few minutes. First, just a big thank you as well to the BC Lung Foundation for inviting me to come and speak today. I love getting out and being a part of these discussions, and I hope that everyone manages to find just even a small nugget that they can pull from this and sort of carry with them as they go on their own radon journeys. When I think about misconceptions, barriers, opportunities, and this topic I've been given to speak on, I really like to focus more on the misconceptions because I found that there are quite a few out there when it comes to radon mitigation. And I break that up into two groups. There's a group of current homeowners, and there's definitely misconceptions with radon mitigation. But there's another unique group as well, and it's potential home buyers and people that might be introduced to the topic of radon for the very first time. So I'll start with current homeowners. Most of the time, the misconception is that radon comes from the ground. They have a concrete slab, basement floor, fully finished. This is going to be expensive. And they just don't quite know what goes into fixing a house for high levels of radon. And sometimes that vision of a bill being extremely high to fix the problem is their reason that they might not go ahead with taking the steps to fix their house if it tests high for radon. And in some cases, there's people that might not even want to test for radon. They, again, have this idea that it could be something that's out of reach for them financially, and they would probably rather just not know what their levels are. Another big misconception with homeowners is especially if they have a newer home where the BC building code now comes into play and says we should install radon rough-in systems and put in a pipe that extends up and out through the roof. They might look at this pipe in their home, see that it's labeled radon, and they may actually falsely believe that this is a working radon system. And never have they had the opportunity to be told that they should test their house for radon after taking occupancy. So then we also look at the potential home buyers. So oftentimes the first time they hear about radon is when they're going through a property disclosure statement. And it's the very last question on that document. And it says, has this home been tested for radon gas? And that usually opens up a lot of questions, and in some potential buyers, some panic. And we certainly don't want home buyers to panic when it comes to radon. We just really want them to be aware that radon gas is an issue and that we want to follow Health Canada guidance that every house in Canada should test for levels and see if it's high. So some home buyers will get proactive and they might talk to their home inspector. And more home inspectors these days are starting to offer up short-term radon testing. And another misconception from short-term radon testing is that this is the end-all be-all number that they should focus on. Really, when we do a short-term test, what we're looking at is the potential for high radon in the home. But if the test comes back low, these homeowner or the potential home buyer should still be recommended to follow up with a long-term test. And it's also the same if a test comes back high. Just because they have a high test doesn't mean that it's guaranteed to be high on a long-term average. They could still potentially have a low overall reading and should also conduct a 91 day after taking occupancy of their home. Um, that potential home buyer, they also wouldn't really have an idea of what it would cost to fix the house if the radon was high, and they can often get lost in the transaction, worrying more about radon than they are worrying about other big ticket items. They should really worry about the roof, worry about the heating system, worry about the structure of the home and the foundation. Has there been previous leak and repair history? When it comes to radon, it's not as big of an issue as other issues can be during the transaction. And if a home tests high, it can be fixed. And my best advice that I always give to home buyers that are talking to me about radon, I just tell them fall in love with the house that you want to buy and just make sure you test long term after taking occupancy. And if a short term test ends up showing that you have high levels during that short test, it's no problem to talk to a certified professional radon mitigator, try to get a quote for a system, and at least have that in your back pocket in the negotiation when looking to buy a house. The the barriers when it comes to radon mitigation in my practice, one that comes up quite a bit from time to time is the people that are renting a property, and it's quite often a basement suite, and the renters start to learn about radon. They get themselves a test kit. Sometimes they'll purchase a digital monitor and they'll want to know for their personal health what's happening in the house, and they'll discover high levels of radon, but they become nervous to approach the landlord and they worry about their rent. Some of them, of course, are doing okay with rent. They've maybe lived in the property for quite a few years, but all of a sudden, if there's a capital expenditure, this could result in an additional rent increase for the tenant. So sometimes they really want to know about radon test. They find that it's high, but they hold back and they're not pushing ahead with installing a radon reduction system just for those cost reasons. Um, then another barrier is you have many homeowners themselves that seem to be very handy people. They'll possibly get a quote for a certified radon system, but then they'll look for a do-it-yourself solution. Some of them will turn to Google searches and YouTube videos, and they'll try to look for a do-it-yourself method to reduce the radon, and quite often are getting misled, especially where here in Canada, and we have areas with cold northern climates, we just install our systems differently than many of the systems being installed in the United States or warm climate areas. And this can be a bit of a barrier in that people are putting in a system, but they don't exactly know if it works. And some people won't do follow-up testing to sort of see if their handyman solution has worked or not. I'll pull up some slides here now to share on my computer screen. And what we're looking at is something that you might find in this photo in a typical new construction home. So this would be around 2018 or newer. And a lot of utility rooms will have this white 4-inch PVC pipe coming up. And what this is the new level 2 requirement for a passive radon system to be installed in a home. And in this particular case, the pipe was visible in the basement, and the homeowner knew that this was for radon, and they just assumed that their radon was being fixed. And it wasn't until after about 4 years of living in the house that the son, who lived in an older home, tested for radon, fixed his high levels, and then loaned his mother his device. And she was quite surprised to see that her house had high levels of radon, even though this pipe was installed. So, of course, we explained that the purpose of this building code step is to make it that if a house tests high, it in theory is easier to reduce the levels of radon. In this photo, what we're looking at is a system that has now been activated. So in the center, we have the radon reduction fan, and this creates a negative pressure underneath the slab, which draws the radon now to that pipe and exhausts the pipe up and out through the roof. And in the best case scenario, it would be as simple as cutting the pipe, installing the fan, doing some pressure testing, and you size the fan accordingly and the system works. But in these newer homes, I would say about 1/3 of them, we end up having to do additional work. And if you look down on the floor, approximately 8 feet away, you'll see a little concrete circle. And what this is we find that builders sometimes are using the wrong pipe. They're have the pipe is filled with rocks in the end, and these systems don't work ideally or how they should. So again, a misconception is that all systems are going to be easy or that even all of these systems already work. But having a certified mitigator come in, go over with that homeowner, especially if they have a recent test result, is critical to getting this dealt with properly. Looking as well on a pipe, you'll notice that there's labels and system pressure monitors. You want to look at the label and look for a licensed certified number on the label. Then you're able to know that this system was put in by somebody with the training and the expertise, and that this system is going to have a warranty or a guarantee with it. And there should also be stay behind documentation with every installation. If you again see a system with a fan on it, but you don't see any of the labeling, this could potentially be a system that's not working. And again, a misconception that you have low radon. Prior to the level 2 radon rough-in requirement, I believe it was close to 2013, there was a level 1 rough-in requirement. And this was as simple as a pipe coming up out of the floor and had to be capped and labeled. Quite often, though, when doing work, we're finding that these pipes are located in very difficult places to get to. And this one in particular is behind a furnace. So the misconception again is that this is now going to be easier for the radon mitigator to fix the home. Not necessarily the case if your starting pipe is in a poor location. This was another one that we found in a home that was located under the stairs. The cap wasn't even glued on properly. This one is an example of incorrect pipe used. Perforated pipe should only be used underneath the concrete slab to help with airflow, but we do see that above grade sometimes. And just poor locations. There's the rough-in. This one's located right tight underneath a set of stairs. So there's just no way that a certified radon mitigator is able to use this to help mitigate the house easily. But luckily, most of these houses will have gravel underneath the slab, and then we are still able to fix every house, but maybe just not as the builder originally thought. Other times you look at a new house and you might think there is no radon system because you can't actually see this radon pipe. Oftentimes we've had to go in with locators and scan, and we will actually discover that radon pipe is hidden within wall cavities. So again, anywhere from 2013 up until now, we would like to think that every home is going to be easy to fix with these measures put in place, but we can certainly still have some challenges and barriers to a cheap system. This one is an example of an uncertified radon system. So again, the homeowner had this misconception that what he saw online with a fan on the outside of the house and the pipe running up to the roof was going to be just fine. And he was quite puzzled after about 3 or 4 months why the radon was still high. And he had phoned me to ask how long it takes for the radon levels to start coming down. Obviously, we went in, assessed his system, informed him that we don't install systems like this, and we made the improvements. And it was all about his soil conditions that he was struggling with. Crawl spaces can be unique as well. So when we depressurize a house to fix it, the concrete acts as our barrier to keep that airflow underneath the home. But if you have a dirt floor crawl space or plastic covering it, some people have a misconception that there's just nothing they can do, or they're not going to be able to fix their house without spending tremendous amounts of money and pouring concrete floors first. But meeting with a certified professional, we of course can walk them through the process that we can fix every house, even if there's no concrete floor. And we come in and we do a sub-membrane system. So we can attach a heavy mill poly down to the ground, and then we attach a radon fan system and piping to that membrane, which creates that exact same negative pressure underneath the house. So again, the message is every house can be tested, and if it tests high, every house can be fixed. And if you see something that looks like this, very good chance that's not a certified system. That should be some red flags to contact a certified professional. So thank you, and I will be around at the end to help answer any questions. Quickly, just also on opportunities, we're doing more and more radon testing throughout the province, moving into smaller and smaller communities. So there's certainly opportunities for more certified professionals to enter the industry and to help reduce radon in these communities. And it should be posted somewhere. Pam mentioned it earlier that the website cnerp.ca is where people can go to look to register online to take online or in-person courses and help join the force of the certified radon mitigators in the province. Okay, thank you, Pam.
Yeah, great. Thank you so much, Graham. And I will direct you to check out some of the Q&A to see, there's a few things I think you can answer in there. And I did put the link in the chat. So there was a question about how do we become certified and what is the certified body? And I will touch on it again here now. But CNRPP is our national certification program, and I put the link to the website in the chat. Good. All right. So my turn next. I'm going to share a little bit about the work that Karst is doing with the Take Action on Radon program, and then a few other initiatives that we're working on as well. Radon Action Month is November, so this is why we try and direct a lot of attention. One of the questions was, when is the best time, or why do we test in the winter? So Radon Action Month is in November because radon levels tend to be higher when the ground is colder and our homes are warmer and we keep our windows closed. So that's why we promote testing in November. So one of the messages that we're trying to encourage now is really focusing on the fact that radon comes from the ground. And so our theme this year has been reducing the risk of lung cancer starts at the ground level. It comes from the ground, and it is important to make sure that when you do have high levels, you do reduce them. So thank you, Graham, for walking us through some of that information. Another bit of information. So on our Take Action on Radon website, we have updated some of our pages to try and make sure our provincial pages has more relevant information for you. So you can check out some of the information by province on the Take Action on Radon website. We have been hosting a program for the last 8 years called the 100 Test Kit Challenge. So some of you are talking about getting free detectors, and I'll talk about a couple programs that are running for free detectors. Generally, most people do have to pay for a radon test or a radon monitor, but there are a couple programs across the country to help with getting some free kits out there. The 100 Radon Test Kit Challenge is one of those. We work with communities to provide 100 free radon kits, sometimes more, so that we can raise awareness in a community and then distribute some free radon kits. We've worked with over 160 communities in all provinces and Northwest Territories. We also have been able to work with many First Nation groups and some Métis groups as well. We do find that there is, although we talk about radon testing is easy, there's a number of steps that you need to go through. And so through the program, we're able to support people with each step of the program. And on average, we see about 74% of the people finalize the full process, and we're able to issue a report. And another thing that we have been doing research on is, when people find high levels, are they taking action to mitigate? And so in 2022, we did some research on this with our participants and found that 38% of those that had tested over 200 had mitigated their homes, which is great news for that 38%. But we were concerned that we weren't seeing higher levels. And so we've been working to include more information about mitigation in our programs, more follow-up information, and as I will mention, that we have done another follow-up study to see if we've improved that as well. So we've been doing this now is our 8th year for the program. Last year, these were the communities that we worked with. So I've highlighted the BC communities. They are in the process of reporting. So after we do a project with a community, we provide the municipality in that community with a report. And we aim to do a presentation to the mayor and council. That information is a great, or that communication is a great opportunity to work with the municipality and help them understand the radon levels in their community, and then also learn about some of the resources that are out there. For example, Health Canada has developed radon action guides for municipalities, so we can share that with them and give them information about different actions that they can take to help their citizens learn and take action on radon. So we're working to share the information out with these communities, and then we will publish our report once we've shared it with the mayor and council. And then we're launching the communities this fall again in these communities. So most of them are new. So we try and target new communities every year. We do have repeating communities. So you can see them listed on that site. And so again, we try and launch them through October and November because it is typically our Radon Action Month. As I mentioned, we have done a mitigation survey in 2022. And so this year we did it again to update the information and find out what lessons can we learn from people who are testing and how can we support them. Because testing for radon is important, but it doesn't solve the problem. It doesn't reduce the radon level. Ultimately, we need to find ways to support people to get to the mitigation and reduce their radon level. And so through the original mitigation survey, we found that some of the problems were people didn't know what their radon number was, didn't know what it meant. And so we've added some information to our reporting to help them interpret that result. People talked about the cost of mitigation, and so we were able to work with the Canadian Lung Association. So there is a mitigation grant now available across the country for people that are in the low to moderate income level. They can apply for a mitigation grant through the Canadian Lung Association. And then we also found that at the time, Health Canada's recommendation was split. So they had like a 1-year, 2-year recommendation. And so Health Canada has recently updated their recommendations to simplify that. And so they're simply stating now that if your levels are above 200, that you take action to mitigate. And so that too, I think we are seeing people, when they take action sooner, that they're more likely to take action. Where if they start to think that they have up to 2 years, the time goes by and they start to forget that they should be doing something about it. So really encouraging people to take action and reduce their radon levels sooner helps them ensure they actually follow through. Another free program that we have is targeted towards the people that have both the smoking and the radon combined risk. And so this is a program that we have developed with the Canadian Cancer Society's Smokers Helpline. It provides free kits through the month of November for those who pledge to quit smoking. They can register for a free kit when they pledge to quit, and we will ship that to them. Again, it's encouraged to help them understand that smoking is one of their risks for lung cancer, but radon is also a significant consideration, and they should be testing their home and reducing it. In addition, this fall, we ran a webinar targeted towards smokers. And so you can find information on that web link on the Take Action on Radon website with the recording from that webinar. And then another program that we have are free kits for people that have lung cancer or their family members. And so although we do target a lot of our information towards prevention, we identified that it is important to support those that have been diagnosed with lung cancer. So we call it the White Ribbon Program. And after talking with people with lung cancer, we found that one of their biggest concerns when they realized that there was a connection between their lung cancer and radon is their family members. So radon exposure takes time before it turns into lung cancer. So they may have been exposed in their childhood home, so they're concerned about their siblings. It may have been in their home where they're raising their family, so they're concerned about their children. And so now they want to make sure that they prevent that in their homes now where their family members are living. So they can order a free radon test kit from us and we will ship that to them. So it's for anybody that has lung cancer or any family member. So that can be siblings, it could be parents, it could be children. And so again, you can go to the Take Action on Radon website and find more information about that. And then we've also been able to partner with the Canadian Lung Association to expand the grant program. So as I mentioned, the Canadian Lung Association has the Radon Mitigation Grant for those that are low income, but they also have included a criteria so that they will provide the grant for anybody who has a diagnosis with lung cancer. So any home where there's an occupant that has a lung cancer diagnosis can qualify for the $1,500 grant as well. All right, so because November is our Radon Action Month, another initiative that we have with Take Action is to try and raise awareness. And so our November program, KNOWVEMBER, is a play on the word November. We want you to learn about radon and share what you know. And this is a contest that runs through the month of November so that you can tell others about radon and have a chance to win. And so we are coming near to the end, but there's still time to sign up. So all you need to do is tell somebody about radon, take a picture, and then upload it to our november.ca website. And we have weekly draws throughout the month of November for $50 gift cards. But we still have our grand prize draw coming up for a stand-up paddleboard, a Fitbit, and a KitchenAid stand mixer, as well as some additional gift cards. So you can check that out. We encourage you to tell others about radon. We need your help in Canada to raise awareness. But if you do it quickly, then you will get the bonus to a chance to win. And so last year we had some really great entries that really inspired us so that we found out that there were people across the country sharing information in really fun ways. And so you can see some of the entries, people telling their neighbors about radon, people learning about it in their newspaper, their local newspaper, and then sharing a test with those in their neighborhood. I love this picture of the telephone, calling her family and friends and telling them about radon, and so really encouraging ways. And some of the entries that we've had this year, a teacher listening in on one of our radon webinars and then sharing it with her diagnostic imaging course. And then again, somebody that has been diagnosed with lung cancer or has been, sorry, a family member is diagnosed with lung cancer, learning again about radon and sending out some texts to family members, helping them make sure that they do test and sharing that information as well. And so that's the contest that you can enter, but not only that, there is a radon game. So you can learn more about radon and have fun knowing about it. The radon game will take you through your community and ask you all sorts of questions about where to test. And so you can check that out also at the november.ca website. All right, and then just as we finish up Radon Action Month, we have requested landmarks across Canada to light up for Radon Action Month. So you can check these out across the country. If you are in BC, you can check out the Vancouver Science Centre, the Burnaby City Hall, the White Rock Pier. We are expecting it to light up, as well as the Maple Ridge Hall. Oh, there may be some tech issues at Maple Ridge. So if you see it, snap a picture for us and let us know it worked. And then also Port Coquitlam City Hall. So we have been encouraging all sorts of action in the month. So here's the announcement for the science world. All right, and then to help you, we do have lots of resources. So check out our website, and we share lots of resources there to help you with Radon Action Month. Also, just a heads up, we do have a symposium coming up in May, so check out information on the Karst website about that. We've talked about the CNRPP certification program, so you can check that out. And then also our list of devices. So there was questions about which ones to purchase. So if you go on the CNRPP site, you can find a list of devices to purchase. There is a long list of ones not to purchase. So if you are directing people to Amazon, we do caution you that you may want to make sure that they purchase one that has been researched and that is approved. All right, I am going to get Krista to start to share her screen while I do her introduction. So Krista Bartholomew is a researcher, projects manager in the Integrative Oncology Group at BC Cancer. She also serves as a program coordinator for the Pan-Canadian IDEAL Trial, the IDEAL Lung Study Canada. With a background in epidemiology and health science, she supports interdisciplinary research into breathe biomarkers, lung cancer detection, and environmental exposures. Yeah, we can see your screen. Krista, take it away.
Thank you, Pam. Can you hear me okay?
Yeah, we can hear you.
Excellent, excellent. So, well, thank you so much for letting me, giving me the chance to speak today. I'm going to be presenting on our lung cancer screening health check in never tobacco users. This is a study done at the BC Cancer Research Institute with support of Vancouver Coastal Health and Health Canada, and is run by Dr. Renelle Myers and Stephen Lamb. So I'll be presenting kind of some of the background and the current study that we are conducting. So just to build on some of the information that Pam shared on the background of lung cancer. So 3,000 British Columbians are diagnosed with lung cancer every year. And as you can see here, I've circled in red, it is the type of cancer with the highest incident and mortality, higher than breast, prostate, and colorectal combined. It also has one of the worst 5-year survival rates, second only to pancreatic cancer. And in 2025, we're expecting about 33,000 men and women to be diagnosed with lung cancer across Canada. But there is some good news. Early detection has significantly improved the outcomes of lung cancer. And there has been a number of screening trials launched across Canada. So here I presented the National Lung Screening Trial and the Nelson Trial have both shown significant reduction in lung cancer mortality, 20% in the national lung screening and 24% mortality reduction with the implementation of low-dose CT screening. So in Canada right now, we actually have 3 provinces with lung screening programs. That's British Columbia, Ontario, and Nova Scotia, with planning and implementation activities planned and pilot studies going into place in Alberta, Saskatchewan, and all the blue there. And in BC, we're proud to be the first province to launch a screening program in Canada. And to date, we have 38 lung screening sites. They're all starred there, so they kind of span across the entire province. And in order to be eligible currently for our lung screening program in BC, you have to be between the ages of 55 and 74 and have a very significant or heavy smoking history, usually about 20 pack years or greater. And in order to be eligible for screening in BC, we look at what we call the PLCO model, which is a model of risk over 6 years of developing lung cancer. So anything beyond a 1.5 increase in risk of lung cancer over 6 years will make you eligible for screening in BC. So that is mostly driven by age and smoking status, but also takes into account things like ethnicity, family history of lung cancer, personal history of cancer, any other lung diseases, BMI, and some demographic information. However, that said, the reason we've set it at 1.5 is there doesn't seem to be a benefit below that threshold that has been modeled, and lung screening isn't beneficial for everyone. So as you can see on this graph on the bottom that I'm presenting here, you see a significant increase in reduction in lung cancer mortality once you across that threshold of 1.5% increase. But below that, we don't really see a increase in mortality reduction. It also results in a number of unnecessary clinical tests, stress and anxiety for patients, and a significant burden to the healthcare system. We just simply can't screen everybody. So what about never smokers? As you can see, most of the screening programs, and the screening program specifically in BC, is all driven by smoking status mostly. But if you have lungs, we know you can get lung cancer. And 33% of the lung cancer cases presenting at BC Cancer have never used tobacco. So we know there are additional risk factors that are leading to the development of lung cancer. And some of these include outdoor air pollution, indoor air pollution, again, that family history, as well as a lot of environmental factors like radon. So in order to address this, we've launched the Screening in Never Smokers pilot study. We're operating out of the BC Cancer Research Institute here in Vancouver, BC. And we are looking to enroll patients between the ages of 50 and 74 who smoked less than 100 cigarettes, cigars, or vapes in their lifetime. And that's kind of what we classify as a never smoker, who also have one of the following risk criteria. So they have to meet those two criteria, plus have an additional risk factor, such as a family history of lung cancer, which we deem as a first-degree relative, so a mother, a father, brother, sister, or child that has developed lung cancer. They've worked as a firefighter, and that's either a structural or wildland firefighter. They have a previous exposure of greater than 3 months to asbestos, or have lived in a home for more than 3 years that has tested high for radon. So all eligible participants are encouraged to reach out to our study team. And if they are willing and they're eligible, we are enrolling them in our study. And as part of the study, they'll receive a low-dose CT scan. And we have 2 sites which they can receive a CT scan at. That's Vancouver General Hospital here in the Lower Mainland, or Kelowna General Hospital in the interior. We then do a detailed questionnaire where we look at family history, smoking history, any other additional risk factors. In addition, we also map their lifetime air pollution exposure, and we look at where they lived and when they lived there, and we map it using satellite and ground-based data to look at what their lifetime PM 2.5 exposure has been. And then at the Vancouver site, we also actually collect a exhaled breath sample. So we're looking to collect volatile organic compounds in the exhaled breath to develop an early detection breath test. And as you can see, that's actually me doing the test. It's very simple. You just breathe filtered air for 10 minutes. And then if they're willing, we ask them for a small blood sample of about 2 tablespoons. And then we provide them with a radon test kit, which I'll detail here on the next slide. So as part of the radon testing portion of the study, all participants are receiving 2 alpha track radon monitors, which they're deploying for 3 months. So we're doing that 90 to 91 day test. And if they're enrolled in the Okanagan, we are mailing them a posted envelope with a return post on it with our entire radon kit. If they're being enrolled here at the Vancouver site where they're coming in person, they're being given the kit with return mail to come back to Vancouver, our Vancouver site. In the package, they receive an explanation of what's supposed to be in the package. There's a number of things included. They'll receive a informational sheet on what is radon and what are safe levels and what should be mitigated and the Health Canada guidelines. They also receive instructions on how to deploy, and this is thanks to Health Canada. They provided funding for radon monitors for all of our participants, as well as some informational on do's and don'ts of administering radon monitors. And then we have instructions on how to mail back in the prepaid envelopes back to our BC Cancer Research Institute. And then again, some questionnaires on household characteristics, year built, what type of home it is, all of that information, which was previously developed by Health Canada and CARS. So thank you for providing that for us. And then again, they receive 2 Alpha Track radon monitors. Each monitor is then deployed for 90 days. We then collect them back. We have them send them back to BC Cancer, We send them out with the 9-digit code back to Radonova for analysis, and then Radonova sends them back to BC Cancer. We indicate to all participants who are participating, if they would like to know their radon levels, they can contact us and we will provide them. Otherwise, all of the information is anonymized and not linked to the participant unless they call BC Cancer and we look it up by their study ID. And to date, it's just some numbers of kind of where we're at. So we've enrolled 150 participants in this study so far. We've deployed 300 monitors. We've received 75 of those monitors results back. We have 85 monitors back now at BC Cancer, so we have a few more to send out. The majority of monitors were sent out earlier to be deployed through this season right now. So most of them are actively being deployed right now by all of our research participants, and we expect them back in January. To date, we haven't had any monitors that have been lost or incorrectly deployed, so nothing that has come back has given us, wonky results. We did have one individual that had very high levels, so 2,750 becquerels, they're home tested for. When we remove that outlier, though, throughout the lower mainline, the average has been about 21 becquerels in households. And we have deployed 2 monitors to each of our participants. One goes into their basement to test the levels in their basement. The other one we've asked them to deploy in the area of the home where they spend the most time. And when we look at all the homes that have had 2 monitors deployed, we actually see no statistical differences between the radon deployed in the basement and the radon monitor deployed in the main living area of the home, which is some interesting results and good because they're all very relatively low so far. And just here on the top, most of our participants are at the Vancouver site, but it's a pretty even split between the Vancouver and Kelowna sites. But however, right now, the Kelowna site is mostly being driven by firefighters enrolling, wildland firefighters, which is great, but we would love to see more of those, interior health. We hear about all these people in the interior that are testing high for radon, and we would love to, if they're interested, to enroll them in the study. They can get a CT scan at Kelowna General Hospital. We'd love to have some of those individuals who, aren't in the screening and can't get screening, but are testing high for radon to come and be in our study and get a CT scan. Because this is a research pilot study, they do have to meet the criteria of being in that 50 to 75 age range and smoke less than 100 cigarettes in their lifetime. And if they have tested in a home high for radon, we do encourage them to contact our research office. I've left my phone and email here of our research team. And we are actively recruiting and have lots of space for individuals to enroll. So with that, I will just say thank you to our funders, our research team, our research partners, Health Canada for providing the funding for all the radon monitors, BC Cancer Research Institute, and Vancouver Coastal Health. So thank you all.
Great. Thank you so much, Krista. Really appreciate you sharing that really important program. I did put the email that Krista shared in the chat. And so just want to remind you that if you do have questions, use the Q&A, and then we will make sure that we answer in the Q&A. If you want to chit chat, feel free to use the chat for chit chatting. But if you do have questions, make sure you copy them back and put them into that Q&A button. All right. Next up is Liz Orton. So Liz, I'll get you to share your screen as I introduce you. Liz Orton is a first-year student in the Master of Public Health program at Simon Fraser University. Before going back to school, she was the Outreach and Communications Specialist for the Iowa Cancer Consortium, where she led the state's radon group for 4 years. Liz is passionate about radon, especially surrounding the topics of mitigation, affordability, renters, and the added risk factor for people who smoke. All right, Liz, thanks for joining us. Take it away.
Thank you. Good morning, everybody. So as Pam said, my name is Liz Orton, and I'm an MPH student at Simon Fraser University. So I'll be sharing briefly about 2025 updates for the library lending program, and we will get started. So in 2024, another SFU student, Riley Condon, surveyed BC public libraries about their radon detector library lending programs. And she found that 89 out of 245 libraries offered radon monitors for patrons, which are shown by library system and health authority on that table. These devices were provided to the libraries originally by nonprofit organizations like BC Lung, SFU, and the Donna Schmidt Foundation. 6 out of 20 library systems had wait lists, and the Okanagan Regional Library had the longest wait list with 439 people waiting for 59 detectors. The librarians reported that the programs don't add to their workload, and staff and patrons appreciated the accessibility of the devices and that they're available for free. And you can see on the table that some library systems and health authorities have less coverage than others. And currently there are no detectors offered in the Vancouver Island health region, at least that was found in this study. If you're interested in starting your own program, let us know. I have my email on this slide as well as at the end, and I can get you connected to the right people to give you more information. So in order to reduce the wait list at the Okanagan Regional Library System and address poor indoor air quality due to wildfire smoke, BC Lung secured a grant from the Community Foundation North Okanagan to supply 12 radon detectors, 10 indoor air quality monitors, and 5 wood moisture detectors to that library system. And then Health Canada also provided funding this year to test 61 used radon detectors from the Okanagan Regional Library and the Kootenay Regional Library Federation. And 40 of these detectors that will be tested were checked out a combined total of over 1,000 times over about 5 years. So these detectors are being used, and we're going to be assessing and making sure that they're still effective and working properly. And then another purpose of testing these detectors that have been used is we're looking at how high levels of PM 2.5 from wildfire smoke may have affected radon detectors used in those areas. So just making sure that the PM 2.5 in the air isn't negatively affecting the accuracy of those monitors. And then as an added win for 2025, the Okanagan Regional Library decided to use their own funding for the first time ever to purchase 10 additional radon detectors. So by 2026, they will have 81 radon detectors available for their patrons, which will hopefully help them kind of get through their wait list and make sure that everybody who wants to test is able to test. So I'd just like to thank the teams at BC Lung and SFU who've worked on this project, especially Riley Condon, who compiled the data shared in this presentation. And please email me if you have any questions, or like I said, if you're interested in bringing radon detectors to your local library. Thank you.
Great. Thanks so much, Liz. Great to have you share that information, and I'll get you to put your email in the chat so that people can have that. And then if you're interested, we do have library loan programs. Thanks to BC Lung, they have been working hard to not only to get the programs in place across the province, but also to support them, encourage them. So go in and check that out. If your library doesn't have one, then you can reach out to Liz and make sure that we get it. It is a great program. All right, next is Lydia. Thanks so much for joining us again today, Lydia. She is a great resource. Lydia is the Regional Radiation Specialist for BC at Health Canada. She's part of the Environmental Health Program team and works to increase public awareness of radon while supporting regional outreach and education initiatives. All right, Lydia, take it away. I see your screen. It looks great.
Great. Thank you so much, Pam. So I wanted to start my update with an introduction to the National Radon Program, which Health Canada leads. So the National Radon Program began in 2008, and it consists of 5 main components, and you can see it on the slide there. So the first is characterizing the extent of the radon problem in Canada through measurement and mapping. Then this helps us better understand radon levels across the country. We also carry out technical projects to develop and validate guidance to reduce radon risk, and then to transfer that knowledge to industry. And another component is radon research to better understand how radon leads to lung cancer. And then we work on encouraging adoption of radon risk management practices in relevant policy and legislation. Our last component is the delivery of radon education and public awareness strategy to inform Canadians on radon risk and then to encourage Canadians to reduce those risks. So I'm going to start off with some updates from our technical operations team. We've been continuing to contribute to and support provincial data repositories as part of a national strategy to keep the picture of radon across Canada up to date. We've updated our radon control standards for reduction in new and existing homes, and it has now been published in the CGSB, the Canadian General Standards Board. The radon passive stack was approved for publication in the 2025 National Building Code, and we are now joining the NICS Codes Canada task group to continue working on radon control measures. With electronic radon monitors now an option for radon testing, Health Canada is continually evaluating ERMs as they enter the Canadian market. So many ERMs were recalled in the summer of 2025, and then there are more undergoing review. The seasonal variation study of radon levels across Canada that we're doing looks to explore the viability of radon testing outside of the heating season. This study aims to provide additional parts of the year where radon measurements may be compared to our guideline level. And data is showing promise for expanding our testing window. So onto some radon outreach and stakeholder engagement updates. Since 2018, we funded 41 multi-year radon outreach contribution program agreements. And that includes some of the presentations we had previously, like the library project, and Krista had talked about the low CT pilot study as well. Our recipients range from provincial, territorial, and municipal authorities, health professions, provincial cancer organizations, and various academic or educational institutions. For Take Action on Radon in 2024, we have some numbers here. I know Pam had shared a bit as well. There were more than 400,000 page views. And then the new public awareness campaign in November, which she spoke about as well, included a game and a contest, and that had almost 20,000 views. And in total, we had 43 communities participate in the 100 Test Kit Challenge. We've run our annual postcard campaign since 2020, and it's been effective in increasing awareness and testing. We did not send postcards this year, and this is to collect data on the impact of not distributing them. We've developed our radon action guides for provinces, territories, and municipalities. And these guides describe why radon action is important and policy action that can be taken where radon action fits into jurisdictional programs. And then on the right-hand side here, we can see a table of our outreach efforts from 2008 to 2024. And that includes our outreach materials distributed, our web page views, our public inquiries, and our outreach and media events. And we can see that it's a sizable number. I'm going to pass it back to Pam as that's the end of my updates.
Perfect. Thank you so much, Lydia. And I threw a couple links in the chat, as Lydia was mentioning, so you can find the list of the ERMs there. But then also she mentioned the seasonal research study that Health Canada is doing. So you can sign up if you want there as well in the link. Great. Thank you so much. And again, I'll just remind you, if you do have questions, to put them in the Q&A button. So just click on the Q&A button and put them in there. And we will take some time after the last presentation for some Q&A questions. All right, Bridget, I will get you to share your screen. Oh, Lydia,
I'm trying.
yeah, Lydia, I'll get you to stop sharing, and then Bridget will. Good. All right. Yeah, perfect.
Okay.
Good. All right. So while you're doing that, Bridget, I will introduce you. Bridget Irwin is a field epidemiologist with the Public Health Agency of Canada, currently supporting environmental health services at the BC CDC, including the radon portfolio. She holds a Master of Science in epidemiology from the University of Western Ontario. Thanks so much for joining us today, Bridget, and we can see your slides. Take it away.
Perfect. Thanks, Pam. Hi, everyone. My name is Bridget, and I'm here today from the BC CDC to give a quick update on our radon data repository. So many of you might be aware of the BC RDR already, but for those of you who are not, the repository pulls together indoor radon measurement data from 20 volunteer radon data holders across the province into a single database. And this can be used for radon research, as well as to inform risk assessment and drive public health action. Residential measurements also feed into the interactive BC radon map shown on the slide here, and this allows for the visualization of spatial variation in indoor radon at a local scale. The BC RDR has been active since 2021, and it currently contains about 44,000 measurements, around 20,000 of which have been geocoded and included in the map, and it is continuing to grow every year. Over the past year, we here at the BC CDC have been conducting an evaluation of the repository, focusing specifically on its acceptability from the perspective of the radon data holders contributing, the representativeness of the submitted data as compared to a random sample collected by Health Canada, and its usefulness in practice to stakeholders and members of the public. We distributed surveys to known radon data holders and repository users, and also conducted semi-structured interviews with a subset. And then we also put a public survey on our BC Radon Map webpage to capture public feedback. So now some results. In the interest of time, I'm just going to focus on a few highlights. For acceptability, we found that the feedback from those currently contributing data to the repository was positive overall. More than 90% said that they were somewhat or extremely willing to participate when first approached, and the majority would choose to participate again if given the chance. Most providers found the process of submitting data to be quick and easy with minimal resources required on their part. And while several reported some initial concerns surrounding privacy and confidentiality of the data, all felt that the BC CDC had adequately addressed those concerns with our comprehensive data sharing agreement. Under representativeness, this figure compares the proportion of radon measurements over the remediation threshold in the data submitted voluntarily to the BC RDR compared to the data collected randomly by Health Canada. As you can see, proportions were consistently higher in the BC RDR data compared to the random sample, which suggests that the repository might be biased towards higher exposure homes. And this is sort of what we expected to see, and it's likely due to self-selection, wherein those with greater awareness of radon or who live in higher risk areas are more motivated to test. And that's particularly evident in the interior and northern health authorities, which have the highest geologic radon potential and where knowledge and testing rates tend to be higher as a result. For usefulness, we found that both the repository data and the BC Radon Map were well used by a variety of stakeholders for everything from conducting radon research to assessing local risk to increasing awareness to driving changes to policy such as those recent building code changes. Users of the map were generally satisfied with quality. However, a few had some difficulties with interpretation, and nearly half had broader concerns about radon mapping in general, worrying that the map might be misleading and used to justify not testing homes in low-risk areas. And the results of our public survey somewhat supported this, with a handful of respondents expressing some confusion about whether or not they should test their homes, given that they live in seemingly low-risk areas. That said, more than 90% of public users found the map somewhat or extremely useful for assessing risk, and the majority reported increased knowledge of the health effects and spatial distribution of radon after viewing the map. Furthermore, more than half of respondents stated that they now intend to get their home tested for radon as a result of the map. Using feedback from the evaluation, we formulated a number of action items that we're now working to implement wherever possible. For acceptability, these included increasing data holder participation rates by exploring new ways to recruit unresponsive radon data holders, as well as providing regular updates to contributors on how their data are being used in practice. For representativeness, our recommendations included continuing to encourage residential radon testing in BC, with a particular focus on regions that were underrepresented in the data, and prioritizing the onboarding of radon data holders in areas with low sample sizes. And for usefulness, our recommendations included incorporating additional data and filters into the map wherever possible. For example, measurements from schools and daycares, workplaces, or filters for the type of dwelling or the presence or absence of a mitigation system. Also simplifying the messaging for lay users to make sure that they know that we're recommending testing regardless of what the map shows your neighborhood is. And then developing a tutorial to walk users through the features of the map. And I'm happy to report that that last one has been completed and will be launching on our website soon. And that's where I'll leave it today. Thank you all for your time, and please reach out if you have any questions about the repository. Thanks.
Wonderful. Thank you so much, Bridget. There are a couple questions in the Q&A for you, so I'll get you to check those out. We will talk about a few of them out loud, but you might want to just answer them there too. Good. All right. Next up, we have Craig Battle. So Craig, I'll get you to share your screen. Craig Battle is a senior marketing and communications specialist at the BC Real Estate Association, the provincial association for BC Realtors. Prior to joining BCREA, he worked in communication and editorial roles at the Weston Family Foundation, Sportsnet, and Owl Magazine. Thanks so much for joining us today, Craig. You can.
Great. Can you see my screen?
I think we see, yes, we see your presentation, but it doesn't quite look like you're in presenter mode yet.
Okay. Is that okay?
Yeah, we can see the next slide. Yeah.
Great. Whoops. Let me just get that in front. Sorry about that. Hold up. Is this still okay?
It's just cut off a little bit.
Okay, that's too
So
bad
you
here.
may want to just put it in presenter, yeah, and then reshare.
Gotcha. My apologies for the slowdown.
No problem. We just as another promo, we've got some great questions in the Q&A, so you should be able to see some of the answers as people go in and answer them. So feel free, even if you don't have questions, you can go see what others are asking and check out the Q&A.
All right, is that working, or can you see my notes?
That's your note screen, yeah.
Great. Sorry about that. I am just going to try again. Oh my gosh.
While you're doing that too, I am just going to post in the chat a link to the BC map that Bridget was just talking about. So if you're curious to go and check it out, you can find the link there. It's an easy one to find. If you don't have the link, you can just Google the BC CDC radon map, and that'll take you up to it. Good. And then while Craig is sharing, I will give a bit of props to BC. So I work with real estate groups across the country, and we certainly have been appreciating a lot of the work that has been done with the real estate groups in BC. So they have been doing quite a bit of awareness and education. And so, yeah, that looks great. Craig, I will hand it off to you.
Sorry, thank you very much. Okay, so I'd love to start by thanking BC Lung for having us here today. We have two key partners for this campaign. We have the BC Lung Foundation, obviously. We've been working with the BC Lung Foundation for going on about 5 years now. BC Lung has helped us create all sorts of resources for realtors. We have radon resources on our website, the realtor-facing portal, that include checklists, FAQs, and all sorts of stuff. So they've been really instrumental in helping us not only with this campaign the last 2 years, but with educating realtors over time. And a lot of the realtors on the webinar today can attest to that. We also received funding from the Real Estate Foundation of BC. They provided some of the funding for the campaign and helped us get that messaging out there. We also worked with two great Lower Mainland firms, Spring Advertising and Genuine Media, both for creating the content with us, and also with Genuine Media, who helped us get the messaging out there. Our objectives for this campaign, it's been running for the second straight year, so I'm not sure if you saw the 2024 version, but we redoubled our efforts and we took a lot of this stuff that we learned and had from 2024 and created a new version for 2025. Our main goals include increasing awareness of radon gas and the associated threats to British Columbians, direct the public to realtors in a digital landing page for additional information, and encouraging the purchase of radon test kits and residential radon testing. Key project deliverables. Number one, digital and traditional advertising. If you've been driving on the highways in Chilliwack, Kamloops, and Kelowna, you may have seen our Pattison billboards. We've been working with Global TV. We did a large chorus spend in general. Global TV, we've had some lower thirds on multiple programs, so you might have seen our radon messaging popping up at the bottom of the screen. If you're watching that, we've also been out there on chorus radio stations, CKNW, CFOX, Rock 101, and a big part of our outreach for this campaign, we wanted to make sure that we were reaching Indigenous communities. So we've done for the second straight year an ad spend on Canadian First Nations Radio and CJNY. We've worked with the folks there to also engage an Indigenous social parasocial video poster named Kiefer Collison. He's from Haida Gwaii, and he's produced some videos to help get the message out to his followers, and they turned out great. We were really, really happy to work with Kiefer. Finally, we're on Google Display and YouTube Digital. That is the bulk of the impressions that we've been getting are related to all of this here. On Global TV, we've received almost 9 million impressions so far, about another 3 million so far on the radio stations. And then Google Display and YouTube Digital is over 3 as well. So we're really, really happy with how that's going. The key for all of this is that we want people to go back to the landing page, radonkills.ca/BC. That is, we worked with BC Lung and our friends at Lung Sask to modify the national page, radonkills.ca, for BC an audience. So we modified some of the maps, we modified some of the information, and we put it out there specifically for folks in BC to learn all about radon, to learn about radon mitigation, and to find test kits. We really, really want people to get those test kits and drive back to the BC Lung website where they can find out more information about that. The third key piece for us is radon realtor awareness. As I mentioned, we've been working with BC Lung for a long time to create those resources and to make sure that our wonderful members are aware of what's going on. We know that there are key members in their communities and key conduits of information. And so getting that radon information into their hands is a key part of our work all year round, but especially during Radon Action Month and during this campaign. For the realtors on the call today, we've launched a quiz contest this year. You may have heard about it. If not, I will put the link into the chat after I'm done. Basically answer some questions about radon, and you could win a long-term radon tester from BC Lung's website, the Luft one. We will be giving out 1 of 5, or giving out 5 of those to realtors as a part of that quiz contest. Lastly, we had one other cool thing. It was lovely to see Jill Hall earlier. She is a fantastic radon awareness advocate. I've worked with Jill for a couple of years now. And this year, as part of this campaign, she brought to us a pilot project from the University of the Fraser Valley, where they are putting test kits into daycares and other places where people are vulnerable. And they came to us, or Jill connected us with them, and we were able to contribute some money to that pilot project. And we were really, really happy to do that. Always happy to work with Jill and all of the great work that she's been doing to get the word out about radon. I'll leave you with just a couple of screenshots. So this is from radonkills.ca/BC. Another one, we want to push people to order their test kits. That's the Lyft one that realtors could win through the quiz contest that I'll post. And then finally, some of the creative for the ads that we've been getting out there into the world. This is based on a previous campaign that Spring and BC Lung had done, and we updated and modified and created some new ads. And the goal is to associate radon with lung cancer and let people know the seriousness, and to try to get that message out there. So that's it for me today. Sorry for the technical issues at the beginning.
No problem. Great that we were able to hear from you, Craig. Really appreciate the work that you are doing in BC. So thank you. All right, so we do have some time for some questions, and we have had some great questions in the chat. Graham, I have a couple that I think if you could join me and help me go through a few of them. There has been some questions about short and long-term testing, and so of course we do talk about long-term testing. Shorter-term testing does exist, and the reality is with the electronic monitors, it's possible to get a result shorter. But do you want to comment, Graham, in some of the homes that you've seen high and low levels, just to say like why we encourage people to test for the long term?
Yeah, certainly. Thanks. And you're right. Like it's these digital monitors that people are purchasing from Amazon or in hardware stores. They bring them home, open the device, and sometimes in as little as 24 hours, they'll start to receive their results. And they might look at a number and it says 205 becquerels per cubic meter. They've done a little bit of Google research and they realize that this is above Health Canada guidance, and they almost go into an early panic mode. They'll reach out, they try to look into fixing their house for radon right away, and quite often I'll show up and we can go through the house and try to better assess their risk, because putting in a system isn't worth money if you don't have high radon. And we can get a spike reading if it was a windy day. We can get a spike reading if they had family over visiting and they were all having showers and cooking and running exhaust fans and changing the pressure in the house. So we'll get high readings, but it might just have been high for that small window of time, and their level could actually be low. So we always want to encourage the 91-day test so that people don't fix for radon if they don't actually have to. So
Yeah.
yeah, I hope that fixes the question regarding that.
That's a great answer. Yeah. Yeah. And as I think Dr. Benoit posted, it could be even shorter. Sometimes they give you 10-minute readings. But the reality is, I've been working on doing the research with RSIC and with Health Canada on these devices. And even the manufacturers of these consumer grade devices do not recommend less than 7-day tests on their devices. So certainly don't want to cut that short. All right. I do have a question for Krista. There was a question in the chat or in the Q&A about the data from the study that you're doing. Are you sharing that with the RDR, the BC map?
Not currently. I'm happy to chat with them more about what we can do to work together with it, though.
Perfect. Thanks for your answer. And that just does highlight the fact that the BC Radon repository is open for various groups to share. So it's a great repository for various groups to be able to consolidate information in. And Liz, I have a question for you about the library programs. And I think I can help you if you don't know the answer to this one. But do you know if the library programs are tracking the radon results?
I will let you take that one.
Okay, all right, yeah. So the devices that the library use are the Corinthium ones that do not share the data. So you don't need a smartphone for them. They're a standalone device, which is nice because libraries value privacy. So they aren't being shared. But in the information that often a lot of the libraries do share, Health Canada has, actually maybe Lydia, maybe you can share something if you know about the research there. But Health Canada does have a survey that is included, a QR code, and often in these library kits. So if people would like to share their results, they can share them with the Health Canada survey. So that's there. And then Graham, I'm going to call on you there is a lot of questions about various building types. So so the basic question was, is it just single dwellings? So I'll let you answer that one quickly.
Yeah, thank you. And I have actually had a chance to answer some of them
Yeah.
already in the question answer. But yeah, when we think of a multi-dwelling unit where we have dwellings stacked on top of one another, certainly I've worked on projects where we do mass testing and we are finding high levels of radon on the second floor, on the third floor. And a lot of this has to do with a closed building envelope. And so warm air rises, that's the thermal stack effect within a home. And if there's high concentrations of radon gas on the ground level, that can, of course, move up and through the other levels of the home. You would generally think that the levels get less as you go higher, but based on other factors, such as people opening and closing windows throughout a day, I've seen long-term test results where even the top floor will test higher than, say, a middle floor. So again, just following Health Canada guidance, every occupancy should test for radon.
Right. Okay. So then single dwelling should test, duplex should test, row house should test, multi-unit should test,
Yeah. Yeah, I think
mobile homes should
the
test.
the saying is unless you live on a houseboat or a tree house, you should go ahead and test for radon.
That's right. Good. Okay. And I have a little bit more. You and I have been having good conversations about stratas and condos. And so when it comes to stratas, testing individual units could be easy. The occupant can certainly test, but if they have high levels, fixing must include the owner. So if you're a landlord, then that means your landlord. If you're a strata, that means the corporation. Do you have some recommendations if somebody's in a strata, how to approach their corporation?
Yeah, most of the time I receive a phone call from an individual that is tested high, and upon making the first appointment, we do discuss them approaching their strata committee or their condo committee, and just simply stating that high radon has been found within the dwelling, and we should test all the units because, of course, there's now a potential that multiple occupants are going to be affected. And then luckily, when we think about fixing the problem for radon, it's better to have everybody work as a solid unit group and fixing all at the same time. Because again, we're playing with pressures. We want to install the best systems we can. We want to use small radon fans that create less noise, use less electricity, and this is easier to do if we're fixing the building as an entire structure and knowing where the high levels of radon are.
Great, good. Thanks, Graham. And so we can do presentations to the corporations to help them with learning and making sure that they're all on the same page. To do that. Okay, well, we are coming to the end, and so I think Men may have a bit of a wrap up. I do want to also share, I know there's been some questions about some of the links that we've been sharing, and so BC Lung will be sharing out the links. Craig just put in the chat, if you scroll up a little bit, the link for the survey for BC contest for BC Realtors. That is due Friday, so don't put it off. Make sure you put that in.
Can we save the chat somehow?
And then they are also recording, and so they will share out the recording as well. That's another question that we've been getting. And yeah, this has been a good group, and lots of good questions and lots of great information from our presenters.
Thank you, Pam, and thank you for all our speakers. Thank you to all of you, and also would like to thank the person who had taken the lead to organize this workshop is Prem Gandhara and Matthew Wong, who is working behind the scene to get this recording smoothly, and we will be emailing you on the link where to find the recording. So for those of you who would want to see it again, as was being questioned, some questions at the Q&A box and also on the chat box, yes, there is a recording, and the link will be sent to you once it becomes available. So thank you to all our speakers who have taken their time, share their expertise to us. This is a very educational and very productive kind of workshop. So we look forward to seeing you all again next year, and maybe longer workshops rather than compressed 2-hour workshop. And thank you to Pam for moderating our workshop today. Thank you all and have a good day.
Thank you all. Take care.